Hello, my name is Alicia Morris. I am a nurse practitioner student at Auburn University. I am going to be giving you just a short little video about thyroid cancer. First off, the thyroid produces hormones that help control the body temperature, the weight, the energy level, and the heart rate. Thyroid cancer develops in the tissues of the thyroid gland. According to the American Cancer Society, there are about 56,870 new cases of thyroid cancer each year. The most common type being papillary. Thyroid cancer is usually diagnosed around the age of 30, and females are more prone to thyroid cancer than males, about 3 times more. But they're not really sure as to why women are more prone to thyroid cancer than men. So some risk factors when you're assessing the patient, you can ask about, do they have a family history of thyroid cancer? Have you been around any high levels of radiation? You can ask them where actually do they work? What are they exposed to? There's a gene called RET that's been found to be associated with medullary thyroid cancer. You also want to ask them about their diet, because a low iodine intake also makes you at higher risk for thyroid cancer as well. So with thyroid cancer, when you're assessing the patient, you want to make sure you're assessing their lymph nodes, palpating their thyroid, because the main sign with thyroid cancer is enlarged lymph nodes, a nodule, or unusual lump that they found on their neck. You can ask them, have you had trouble breathing, cough, have you had neck pain, have you had a hoarse voice? Because actually 75% of the population at least at one point in their life will have a nodule, but less than 1% are malignant. There are 5 different types of thyroid cancer, the first being papillary, and it is about 80% of the cases, but it is slow growing. The second is follicular, and it's about 15% of cases, and it's the second most common, and it is found in countries where they have a low iodine intake. The third is oxyphyll cell carcinoma, and it is found in about 3%, and it's a subtype of the follicular cell carcinoma. The fourth is the medullary, and it's about 3%, and it develops in the C cells in the thyroid gland, and it also produces a high level of calcitonin and carcinoma embryonic androgen. And the last is anaplastic, and it's about 2% of cases. So papillary and follicular have a 97% cure rate. They are basically treated by removal of the lobe of the thyroid where the cancer is located. Medullary is the least common, but it does have a bad prognosis just because it tends to spread very quickly. So to remove it, you would have to completely remove the thyroid plus the lymph nodes around the neck and the front. Anaplastic is the least common, but also has a poor prognosis because it is usually not found until it's spread. To diagnose thyroid cancer, you can either do a biopsy, a PET scan, an MRI, an ultrasound, or a CT. There are 5 different stages of how the thyroid cancer is staged. The first is basically the size of the tumor, and the cancer may or may not have spread to the lymph nodes. And then the second is where the cancer may or may not have spread to the lymph nodes, but it's spread to distant areas of the body. And the third is when the tumor is 4 centimeters or larger and has not spread to the lymph nodes, but it can be growing outside the thyroid. The fourth is the most advanced, and it's kind of broken down into 3 different, but it's basically if the thyroid cells have metastasized or spread to different lymph nodes, or it's in the spine or near large blood vessels. And then the fifth is also broken down into 3 different stages. It's when the tumor is contained within the thyroid gland, or it has spread to different parts of the body or different lymph nodes. So as far as treatment, treatment is based off of what stage you are in and what type of thyroid cancer you have. So they can either do chemo or radiation, or they can actually remove part of the thyroid or remove the entire thyroid. So I would just educate my patients as far as staying away from high radiation, and just showing them how they can actually check their neck for enlarged lymph nodes, or just to make sure they reach out if they notice anything different and any unusual lumps. All right, well that finishes my video. Thank you.